So the last part of Objective 21 is implantation, and implantation is found in Chapter 8. Implantation, or the embedding of the blastocyst into the endometrium of the uterus, begins around day 5 or 6 after fertilization. So the ball of cells actually floats through the fallopian tube and enters into the uterus while it's dividing before implantation occurs. Progesterone stimulates the endometrium of the uterus to become thicker and more vascular in preparation for implantation. An enzyme secreted by the trophoblast, or chorion, digests the surface of the endometrium in preparation for implantation of the blastocyst. Implantation normally occurs in the upper part of the posterior wall of the uterus. Objective 22 says identify proper use of hormone replacement therapy throughout the woman's lifespan. When we use hormonal replacement therapy is used following menopause. And it's using a combination of either estrogen or progesterone, or maybe just even estrogen products. Hormonal replacement therapy should be used for only short-term use and in the lowest effective dose. This is because it could potentially increase the risk for breast cancer and other types of female reproductive cancers. Counseling should be provided to discuss the benefits and risks of hormone replacement therapy with the healthcare provider. Women's healthcare nurses should stay informed on research on hormone replacement therapy to provide and educate women on developments in hormonal replacement therapy. It is so vital that we stay on top of this information, and as new evidence and research is done, that we can correctly inform our patients of the risks and benefits for using hormone replacement therapy. Careful evaluation for breast cancer risk factor identification is essential for any woman on hormone replacement therapy. And so you as a nurse need to make sure that you are asking specific questions about estrogen-dependent breast cancer and other types of cancers, female reproductive cancers in the female's history. Objective 23 says compare and contrast various contraceptive methods in terms of safety, effectiveness, convenience, availability, and expense. This is back in Chapter 7 in your book. Contraception is the intentional prevention of pregnancy during sexual intercourse. Birth control is defined as a device and/or practice to decrease the risk of conceiving or bearing offspring. And family planning is a conscious decision on when to conceive or to avoid pregnancy throughout the entire reproductive years. So there is a difference between contraception, birth control, and family planning. Factors affecting contraception effectiveness include the frequency of intercourse, the motivation of the couple to prevent pregnancy, understanding how to use the method, the adherence and consistent use of the method, the provision of short-term or long-term protection, and the likelihood of pregnancy. So when we talk about contraception, we need to talk about all kinds of contraceptives. Spermicides is just one of those. Spermicides, again, this is all in Chapter 7, work by chemically acting on the sperm to kill them. It can be used in conjunction with male condoms. There are intravaginal spermicides that are available as foams, tablets, suppositories, creams, films, and gels, and the failure rate of using spermicides alone is about 29%. Male condoms are made of latex, and the latex ones are the only ones effective against HIV. They can also be made of polyurethane and natural membranes. Female condoms cannot be used in conjunction with the male condom, and you will be doing some skill stations over all these contraceptive methods to get more information about them as well. This is figure 711 in your book, and it's all different types of spermicides. This figure is a figure similar to the one in figure 712 in your book. It is mechanical barriers. They actually prevent sperm from going through the cervical os, and they would include the female condom, the male condom, the cervical cap, and the diaphragm. Just a few little information about diaphragms. Diaphragms must be fitted by the healthcare provider. A new one is required after a weight loss or gain of more than 10 pounds or after delivery of an infant. Cervical caps are similar to diaphragms. They are most effective for someone who has never had a delivery before. And you can see about home care use of diaphragms in your book. There's home care use of care of the diaphragm. The vaginal sponge. The vaginal sponge is available over the counter. It must be left in place for 6 hours post-intercourse. Most of them do have spermicide added to them, and most must be moistened prior to insertion. It can cause irritation or allergic reactions with for the individual using the vaginal sponge.